All right, well, Michigan is one of several states already dealing with a shortage of nurses. And a new study from the University of Michigan suggests that situation could quickly get worse. Jacqueline Francis is live with what a survey of nurses is revealing. Jacqueline.
If you or a loved one has been in the hospital, you know how critical nurses are to the quality of care. But the number of nurses is dwindling fast, which is why the University of Michigan conducted this study in hopes of identifying the problem to inform better solutions. The nursing shortage in Michigan is nothing new, but these numbers are. About 39% of nurses in the state say they plan to leave their job in the next year. The University of Michigan put out the results of the study after surveying nearly 10,000 nurses early last year. One of the lead authors says what's really troubling is the number of new nurses intent on quitting. About 59% of those surveyed under the age of 25.
We expect nurses to retire. We expect nurses to move on. But when our newest entrants to the field are saying to us that they want to leave their employer in their position in the first year, I think that should set off alarm bells that things are not well.
The survey also asked nurses what is driving them away from the profession.
Nurses uniformly told us the two things they want help on are increasing and improving staffing that's been chronically short for 10 years, and that they are the victims of violent events in their workplaces. So those are two areas that hospital leaders can get going on tomorrow. There's also legislative approaches and policies that can help that.
Without action, he says the future health and safety of Michigan residents will be at risk.
So if we don't shore up nurse staffing and more nurses leave, the ability for our family members, our loved ones to get safe and effective care is really compromised.
The study also put out recommendations for how to reduce the number of people leaving the field, like implementing mandatory nurse-to-patient ratios and getting rid of mandatory overtime. We're live in Detroit. Jacqueline Francis, Local 4.
Jacqueline, I'm wondering, we saw the exceptional strain on nurses when COVID was hitting hardest. Is there any sense of how big a role the pandemic has played in this burnout?
Kimberly, they say the pandemic made a bad situation worse and that these frustrations with workplace burnout and understaffing went back years, and then certainly the COVID pandemic did not help any of that.
Sure. Okay, Jacqueline, thank you.